I'm going to be your nurse today.
Hi.
What's your name? First and last name and your date of birth.
Laura Lord, March 1st, 1982.
Okay. Laura, I'm going to be doing an assessment on you today on your 12 cranial nerves, your musculoskeletal system, assessing your abdomen, and some joint pain or tenderness, okay? If you have any questions, just stop me and let me know. Everything is completely confidential, and I will be providing privacy, okay? So first we're going to start off with your 12 cranial nerves. So the first one is going to be olfactory. So can you close your eyes? What does that smell like?
Alcohol.
Great. So cranial nerve number 1, olfactory, is intact. Cranial nerve number 2 is going to be your optic. So can you read this for me?
Annie R.M.
Great. So cranial nerve number 2, optic, is intact. Cranial nerves 3, 4, and 6 all kind of coincide together, which are ocular, motor, trochlear, and abducens. So I'm going to dim the lights. Can you follow this for me? Great. Now I'm going to cover up this eye. Check your pupils. Great. Awesome. Okay, so your cranial nerves 3, 4, and 6, which are ocular, motor, trochlear, and abducens, are all intact. Your pupils were equally round and reacted to light and accommodation. Okay? So cranial nerve number 5, which is trigeminal. Just going to touch your face. Can you feel that?
Mm-hmm.
What about this?
Mm-hmm.
Great. Okay, so cranial nerve number 5, which is trigeminal, is intact. Cranial nerve number 7 is your facial nerve. Can you raise your eyebrows? Now frown. Okay, what about puff out your cheeks like a fish? Great. So cranial nerve number 7, facial, is intact. Cranial nerve number 8 is acoustic. I'm going to need you to just cover up one ear, and I'm going to whisper something, and you just repeat what I say, okay?
Okay. Laura.
Okay. Can you cover your other ear?
Annie.
Great. So cranial nerve number 8, acoustic, is intact. Cranial nerves 9 and 10, which is glossopharyngeal and your vagus nerve, also kind of coincide together. I'm just going to observe your difficulty swallowing. Can you swallow for me? Great. No difficulty. Have a tongue blade. Check your gag reflex. Can you open? Can you say ah? Great. So your gag reflex is intact. So cranial nerves 9 and 10, glossopharyngeal and vagus, are both intact. Cranial nerve number 11, which is your spinal accessory. Push up against me with your shoulders. Great. So cranial nerve number 11, spinal accessory, is intact. Cranial nerve number 12 is hypoglossal. I'm just going to assess your tongue. Can you open your mouth? Okay. Now just protrude your tongue, stick it out. Great. Okay, so cranial nerve number 12, hypoglossal, is intact. Okay, so now I'm just going to assess your joints in your hands, assess for any tenderness, pain. Do you have any pain while writing or picking anything up in your joints? Okay, so there's no tenderness, swelling, there's no redness, inflammation of the joints of the hands. So that's great, okay? You want to work on your range of motion, your musculoskeletal system? Okay, you want to stand up for me? Okay, so we assessed both joints bilaterally. Now we're going to start with the neck. So you want to flex down, chin to chest. Extension is back up normal, and hyperextension is all the way back. Any pain there? If there's any pain, just let me know and we'll stop, okay? Now we're going to go with the shoulders. So kind of like reaching for an overhead light. That's going to be flexion. Okay, no pain there. Down back by the side is extension. And reaching backwards is hyperextension. Reaching for the bedside table is an example of abduction, the bedside table on your side. Reaching for that opposite bedside table is adduction, okay? Coming closer to the midline. So now we're going to start with our elbows. So kind of scratching the opposite side of your back, that's going to be external rotation. Down back, kind of on this side of the lower back, is internal rotation. Now we're going to start with the wrist. So no pain at all, right?
Mm-hmm.
Okay. Put your wrist down like that. That's going to be flexion. Normal back up. That's going to be extension. And up, that's going to be hyperextension. When you put your palm down, that is pronation, and palm up is supination, okay? So your hands, we're gonna assess your hands. A fist is gonna be an example of flexion, opening them back up, that's gonna be extension. So when we spread the fingers, that's gonna be abduction, and bring them back together, that's gonna be adduction. No pain or tenderness there, right?
Mm-mm.
Okay, so now we're gonna work on our hips. Kind of bring it up is flexion, great, and back down is extension. So now internal rotation, that's gonna be adduction, and away is abduction, okay?
Okay.
Now your knees, we're gonna put your heel to your thigh. That's gonna be an example of flexion, and back down is gonna be extension, okay? So no pain there, right?
Mm-mm.
So your ankle, we're gonna kind of extend and point the toes down and flex. We're gonna point them up. Okay? An example of eversion, it's kind of like just rotating the sole kind of laterally. That's kind of outward. And inversion is, towards the middle, more medial. Okay?
Mm-hmm.
So we're gonna work on your trunk and your spine. So just lean over to touch your toes. That's gonna be flexion. Back up is extension, and back is hyperextension, okay? Great, no pain or tenderness there, right? An example of lateral flexion is just kind of moving your palms from left to right on your thighs, okay? No pain there, right?
Mm-mm.
Great. Okay, so we're gonna work on some things. A technique, your finger to your nose, just arm out, index finger, touch your nose. Great, now back out. Okay, put your arm down, close your eyes. Arm back out to your side. Now finger to nose. Great. Back out. Awesome. Okay, you can sit down for this one. This is the heel to shin. We're gonna, with this heel on this side, just move it on the opposite leg from your knee down to your big toe. Yes. Okay, now let's try it again with your eyes closed. Great. Okay. Now we're gonna demonstrate rapid alternating movements. So just with your palm, slap your thigh. Now flip your hand over, slap it again, and again, and again. Just working on your movements, okay? Now we're gonna do the Romberg testing, so you can stand back up. Have your feet together, and for about 30 to 60 seconds, we're gonna notice your ability to maintain your posture, okay? And then I'll do it with your eyes closed. So we can close your eyes for 30 to 60 seconds, just to see how well you can maintain your posture, okay? Okay, now we're going to inspect your gait. So if you could just kind of maybe start here and walk this way, just going to check your swing of your arms and just maintaining your posture and making sure your gait is normal. There's no abnormalities about your gait, okay? So everything going good? Okay, well you can sit back down. We're going to work on your 1-2 point discrimination.
Okay.
So just put your hand out. Just tell me if you feel like you can do it with a paper clip or tweezers. So just tell me if you feel like I'm doing it with 1 point or 2, okay?
1,
Okay.
2.
What about this?
1,
Uh-huh.
2.
Great. Okay. Well, you passed that. Great job. Okay, so now we're going to go with the light touch. So I'm going to have cotton ball again. Just across your face. Tell me if it feels the same in all areas of your face. Yes?
Mm-hmm.
Great. Well, your light touch is wonderful. Okay, so now we're going to work on your proprioception, which is, I'm going to be dealing with your toes. So just want to make sure we can see your toes. Okay. So I'm going to be messing with your big toe. So just let me know what you feel like I'm doing, okay? Just close your eyes. Tell me if I'm going like outward or inward towards the others or maybe up and down, okay?
Okay.
Okay.
Out to
Right.
the left, towards the others to the right.
Mhm.
Down.
Right?
Up.
Great. Okay, so your proprioception is intact. Great job, okay? So now we're going to assess your abdomen. Just going to get you to kind of lay flat and just pull your shirt up a little, and we'll inspect your bowel sounds and assess that, okay?
Okay.
So I'm just looking at the skin right now. The skin is pink, it's intact, no scars or piercings noted. I'm sorry if my My hands are cold, but I would have washed my hands first. And no stria or lesions, no pulsations noted, no abdominal distension noted, no visible peristalsis, and your umbilicus is midline, and it is inverted. Okay, so now I'm going to auscultate your bowel sounds in all 4 quadrants. Okay, so your bowel sounds are active in all 4 quadrants. You can they're either going to be hyperactive, hypoactive, or just active. I would wait and listen for 1 minute. Normal bowel sounds is between 5 to 30 per minute. Let me move this back up. 5 to 30 per minute. Okay, so just raise it back up one more time. I'm going to just name some organs that are in all 4 quadrants. So this would be your right upper. That's going to be your gallbladder. Your left upper is going to be your spleen. Your right lower quadrant is going to be your appendix. And your left lower quadrant is going to be your sigmoid colon. Great. Okay, well, you can put your shirt down and sit back up. Thanks for being my patient today. You did a great job. Do you have any questions?
No, thank you.
Great.